Hi, everyone, and welcome to today's conversation with Professor Welma Lubbe. She is nationally known as well as internationally a leader in nursing and midwifery, and especially neonatal care and care of the premature baby. Welcome, Welma, and thank you for being here this afternoon.
Thank you, Emery, and thank you for having me.
Thank you. Today is a very special day because so far we have spoken with nurses, nurse educators, researchers, nursing students from the perspective of a nurse about presence. But today it is about the perspective of a patient. So although you are a nurse, I'm going to ask you from being a patient and your experience of presence. So tell us a bit about yourself, please.
Okay, so I live in Potchefstroom, which is great, and I have a lovely family of two children, small, 7 and 9. No, I lie. They're 9 and 11 already, and a husband. And I work at the Northwest University as part of the midwifery team, specifically with the neonatal part. And my speciality area in my profession is then premature babies and everything that have to do with tiny babies. On a personal level, I was diagnosed with breast cancer when I just turned 40. And then went through all the treatment, and I was clean and clear for about 2 years, 2.5 years. And then the cancer returned. And last year, 2019, about October, I was re-diagnosed with breast cancer. And then I took a different route of treatment, or additional treatment. And I just finished my chemotherapy, starting with a continuous treatment that I will have until February of next year. So I'm healthy at the moment, but I still get treatment every 3 weeks. That, in a
Mm,
nutshell, is the story.
okay. Thank you for sharing that and all of the best with this journey. So it seems that you are still in the middle of this journey with your family and experiencing that really as a patient.
Indeed, and it's quite a journey. But like you say, well, the biggest part is done. So maybe I can give a little bit more of information. So the first time round, I had chemotherapy, and then I had a small breast operation just to take out the lump, and then I had radiation for a few sessions. One is done, and then every 3 months you go for follow up, and they do blood tests and X-rays and so on to see if everything is fine. So in one of the follow ups, then I went back for a mammogram, and they saw there was calcifications, and then they redid the biopsy and saw, well, the cancer is back. And because it was a returning cancer, they had to do more invasive treatment. So this time round, I had to had a double mastectomy, and I was very fortunate that I got reconstruction as well. And I think that's the part that I would like to elaborate on, because that's the time when I work most intense, being very vulnerable, and had a lot of nurses around
Mm,
me. But after that, after recovering from the operation, which is quite a big one, I started with two different kinds of chemotherapy running over 6 months. And then after that, I couldn't have radiation again, because you can only have that once in 10 years. But then I'm on a blocker, a hormone blocker, for the rest of the year, which is then the treatment I'm currently having. So at the moment, I'm exposed to nurses in the oncology unit, in the treatment
mhm.
unit. And I must say, it's a wonderful experience. It's really good. So um, I really, you meet so many people on the journey, and you make so many friends, not patients, but also then health. And I really want to include all the staff there. Because if you sit and you get chemotherapy, within being in COVID, it's quite a lonely place, because your family and your support system can't be there. So it's only the healthcare
Mm,
staff that can really be there. And that thing where the doctor would come to you and say, I really want to give you a hug, even though we're not allowed to. That's really
mm,
that thing of, I'm there for you. and you can
mm,
anything you anything other than give you the treatment. We are here. And then with the
mm.
nursing staff, it's actually a fun place to be in an oncology treatment unit. It's not so morbid than everybody would think, because we would come in and you would talk and share stories and how was your week. And it was very funny because we had men in the unit as well, and they would always come in with their hands being very sensitive from the chemotherapy, and they could wear gloves so that you can actually hold your cup so that you don't lose that feeling. And it was pink gloves, or it looked like pink gloves. So the men with their pink gloves was quite a thing.
Yeah.
And depending on what kind of cancer they have interesting stories about that as well. But then we
Mm,
have the nursing staff that put up the drips for you, and they make you comfortable, bring you a blanket because it can be very cold.
mm,
That's also working there. And when you come, it's always, "Good morning, Valma. How are you? How was your week?" And they're really concerned about how you are really doing, and they can see
mm,
when you're down and you don't feel well. And they would come and sit next to the patient and just have an individual conversation, hear if everything is fine, put their hand on yours. And I think that's something that was very special for me, just that touch, some other
mm,
human being being close to you,
mm,
and remember your name and way. And then we had a lovely tea lady. She was fantastic. So she would come around early in the mornings and ask who would like what to drink. And then with COVID, we were not allowed to have coffee and tea in the unit anymore because of infection control risks. So we had to get past that one. So creatively, everybody took their own cups and their own coffee. And then she'll still come around and she'll just fill everything up with boiling water for us. But she was there, always ask, "How are you?" and say goodbye. And it's not part of her job description, but she was always there for us. So in the oncology unit, it was fantastic. Just people being around you and caring about you, and really being considered about how are you really today. And
mm,
that touch, that personal touch, that's so limited now in the COVID situation.
mm. It seems that being seen as a human being was really special for you, and that they know your name and come and sit and see if you are not feeling that well, and the hug and sitting next to you seems like it's really and you say it was a wonderful experience or is a wonderful experience. Mm,
No, indeed it is. And that was really the special things. So getting
mm,
the medication so you don't get nauseous, and working softly with you so it's not so painful as they put up the drips, those are all important things. But
mm,
yeah, strangely enough, that's not the things that you remember. You remember that
mm,
person being there. And I also
yeah.
remember another patient sitting next to me, and it was her first day, so she was very scared, and it was an older lady, and immediately her hand went out so that she could touch me, and that we could have that connection. And I think that's
Mm,
the special part, being in a caring situation, whether you're the professional nurse, or whether you caring from a patient perspective, because that can also happen. But
mm,
that, yeah, being available, reading the other person, reaching out when that's needed. I
mm.
think that's very important.
Okay, wonderful. So even the experience with a fellow patient was also special
Mm.
for you, the connection and reaching
Absolutely.
out. Mm, mm. So if I can take together, if we connect what you have said with presence, it seems that moments of presence for you was not necessarily only the medication and the competence in the procedures, but the
Mm.
whole atmosphere of caring and being there for you and with you, even patients being there for one another.
Absolutely. I think that's a good way to summarize it. And that doesn't take away from the skills that
Mm,
we as professionals. That for me was also very, very important. When I was in the
mm,
hospital after the mastectomy, you're so vulnerable. You can't reach for your own water. If you're uh, if you have pain and there's not somebody that reacts to that, then you're alone and isolated.
mm,
My husband couldn't be with me all the time, but he could be there most of the time. So I especially remember waking up. from the after theatre, and having on, put some lip eyes or Vaseline or something on my nose. And it's not something that I
Mm,
asked for, but it's something that somebody saw that should be done,
mm,
that can make the patient more comfortable, and she did it. And I think
mm,
apart from the skills that we are taught, this is the way that you clean a drain or um, do a wound care or whatever, those small things that go unseen is actually the things that
mm,
make a difference. I think skills is the in seeing unseen thing or unasked things, because I think patients are
mm,
scared to ask. They're afraid, they feel very exposed. They're also afraid that if they ask, they will be bullied by the healthcare staff. And I did experience that the first time round. But this time round, I was so surprised by the nursing staff. They were really there, physically all the time,
mm,
emotionally all the time as well. They reached out, they saw things even before I had to ask for it, and that was great. So yeah, with
mm,
presence, just being there, seeing things that need to be done without anybody asking, seeing that a pillow doesn't look so comfortable. If you move it a bit, it can be more comfortable in a different way. Double checking that your medication is working and that you're actually feeling better after you received your pain medication, and not just giving it and running away because you have other
mm,
patients. And it's different for very busy. Um, but I must say, in this instance, I really had hope for the nursing profession, because everything that I think need to be there in a caring profession, I experienced when I was in hospital, and I still experience it now that I'm an outpatient in the oncology unit.
mm. Wow, that's a wonderful testimony to how it can be a caring environment and how nurses can be present
Mm.
with you.
Absolutely.
That's amazing. Yeah, and I think especially what you are saying about not even having to ask, but they sensing your needs and attending to those needs. That's very
Yes.
special.
I think that was the
Mm.
most important part for me. That invisible, I want to call it something invisible, because it's yeah, you're
Yes.
sensing without having seen it on the monitors or anything like that. And yeah, that's very, very special.
Wow, that's great. Uh, what did all of this presence mean to you? You are saying that it gave you hope for the profession, and you,
Mhm.
while you were feeling very vulnerable, you felt that they sensed your needs and they attended to that. In your healing process, what is presence meaning to you?
Um, I think it's a very large part of the healing process, because there's a lot of emotional stuff that you don't need to also address.
Mm,
And I think that part is important. So I almost want to say it's it's like that story of the glass being half full, half empty.
mhm,
Present is that part where you have to heal physically and emotionally, and you get to a certain point, and then you get depleted. So now you have to use a lot of energy to
mm,
continue that healing process to get to the full part of the glass. With presence not being there, it's actually taking away a lot of that healing energy. With
mm,
presence being there, you don't need to even think about it. It's just there. So it keeps your levels there, or it even push up your levels, so that you can really only focus on the physical part of getting healthy, and the mental part. But there's no extras that you need to give
mm,
attention. And I think that is what presence is really mean. Um, it lifts that bar so that
mm,
it's easier for the patient to get to full healing without using a lot of energy. And I
mm,
can really say that for the different team members that I've been involved with. The nursing staff play a huge role, and it differs depending on where they are, but you have a different connection because they're next to you. They're the one that
mm,
you ask the question. The pharmacist we had there, it's like this, you can ask these questions that you would usually go to Google for. Um, but it's there and you can get it, and it's immediate feedback, but it's a little bit more in a distant. Where with the medical doctors, they tend to focus a lot more on the illness. And they also say, I
Okay.
want to focus on the illness because I don't have the energy to deal with all the emotional stuff that is also part of this
Mm.
condition, which I can understand from their perspective in
Mm.
order for themselves to remain healthy and mentally healthy. But I
Mm.
would like that a little bit more from the medical doctors to be a bit more there. And I can see you don't feel well, or I can
Mm.
hear that you are concerned. So they tend to hand that off to somebody else. But the nursing staff actually step in very nicely into that role, and
Mm.
even your secretary, ward secretary, or the oncology unit secretary. It's very important the way that they greet you in the morning, that you don't feel you're unwelcome and you must step on eggs and so on. That really
Mm.
make you feel this is your place as well, and you're welcome here, and you can feel free to ask. And so it gives you more of a home-like environment and take a
Mm.
lot of stress away, because it's a very,
Mm.
very stressful situation. It's very traumatic, and it's stressful because it's unknown. And even
Mm.
if you work in a hospital environment, it remains unknown because you stand on the other side. If you're the nurse or the midwife, then you know what to do, you know what to expect, and you're not emotionally involved.
Mm.
You connect, but it's not your life that's touched.
Yeah.
Where if you're the patient, then you know what can go wrong, and you don't
Mm.
have any leverage to say, well, I don't agree with this from a medical perspective, because you're not the sister in charge of that unit. You're a patient.
Mm.
And there is a difference. There is a difference. So I
Mm.
think for nursing staff to be present is to acknowledge that and take the patient to be part of the process. So as a patient, what do you think? What did you read up
Mm.
on this condition? How do you feel about the treatment of nausea or your hair falling out? What worked for you? How can you support other patients? So that advocacy role, I think presence in the advocacy is also very closely linked to each
Mm.
other.
Definitely. Yeah. And to meet the patient where they are
Mm.
at in that moment and create a safe environment and a friendly environment so that they don't have to spend energy in that
That's right.
vulnerable moment to work on that as well. So to create
Yeah,
a safe environment so healing can take place. Um,
absolutely. That's very
oh,
true.
that's amazing. Yeah. Wow. I'm so glad for you that you had such a positive experience,
Me too. Because
even
it's
though it
important.
is difficult.
Yes, it's very important what happens with you in your treatment area, because you come back and you're still a mum and you're still a wife and you're still at
Mm,
work. So you need the energy to actually continue with that as normal as possible.
mm,
Um, I think being a wife, you're allowed to let your guard down
mm,
more, but being a mum, I don't think you're so much allowed to let your guard
mm,
down. You
mm,
can, and it's very important to take your family on this journey with you. But it's no use for the kids all the time to know that mom is not feeling well and mom is scared
mm,
about the future, because all they remember is mom is scared about the future. She don't know what's going to
mm,
happen. And they go to school and they come back and that's still what they remember. They didn't go through the process of, okay, I was scared, but I cried about it and I'm fine now, and now I can go on with my day. And
mm,
it's all right. I'll worry about it again in a week's time. So
mm,
you need that energy in your treatment area, and you need to be supported for that so that you can play the normal role that you have
mm.
in your family environment. So
Yeah,
that is also, I think, a very important aspect that one forget about.
yeah, definitely. And it's such an important part of the treatment.
Absolutely, yeah,
Mm, sure. It has a ripple effect.
very much, very much. And I
Mm,
think something that I can maybe mention is coming from a husband's point of view. I always got the feedback that it's very difficult to be the support person.
mm,
So being that person that delivers the presence, whether it's a healthcare professional or a lay person in your support network, that's very difficult. It's a different kind of trauma. Being the patient is you run you down again and you see the light at the end of the tunnel. But somebody standing next to you can't do anything. They can be there, they can hold your hand, but they can't make it better. They can't let it go away.
Mm,
And I think that's a very vulnerable and a difficult place to be because
mm.
you feel so powerless.
Definitely, yes. So that also requires nurses to really be in touch with the support person and noticing their needs.
Yes, absolutely. And I
Sure.
think what's important there, also taking now COVID-19 into
Mm,
consideration, is you can't have that support person there. So my husband and my kids can't see how I get the treatment, and it's actually okay. I look fine when I get it. I'm not somewhere locked up in a prison kind of place. It's
mm,
okay. So we would do a lot of pictures and send that to them and so on, but that's not the real thing. So at the end of the chemotherapy treatment, we arranged now. Potchefstroom Clinic now have a bell that you can ring as
mm,
well at the end of your treatment to symbolize that everything is done. But being in COVID, they don't allow visitors. So this would be part of that final thing for the whole family to take part in, to say, well, this is the end. We're done. And we actually couldn't have that because of the limitations to the visitors. But there, the staff came in very nicely and said, okay, let's keep with the rules of COVID and protecting ourselves and everybody around us. Come in for that 5 minutes so that we can have this final event
mm,
and that the kids and my husband can witness that I'm actually ringing the bell and we're ending off this story. And they help take a video so that we have some memories on that. And it happens spontaneously. So I think that's very important where
mm,
the staff can actually go to limits to be at that safe point, but also really recognize the importance of human presence
mm,
and human touch. And that I think, especially in this time of COVID, I think that's a very important message. Wherever you are, there's always a way to go about to make sure that we have touch, that we have that connection.
mm,
Um, and I hear that from people that are actually now. And I had a grandmother that also passed away in this time, and we think it's because of the fact that she couldn't see her kids for 5 weeks. She had a heart attack at the end of the
sure.
day, but we think it was that thing because they get isolated in the old age
Mm,
home. And I think that's the other problem. People, I need my people to heal. There's so much research on it that says we need our families in that healing
mm,
process. But how do we do it in a case where we really have to isolate for the sake of safety? But I
mm,
think there's ways around it. There's small things that one can do, like I've explained. And I think that's an important challenge for healthcare staff. How do we ensure that we have that connection, even in times, well, because with cancer anyway, with that treatment, you are immune compromised. So
mm,
even in a normal setting, we limit visitors and those kind of things. So how can we make that better, although we have to have that conditions? So actually, I
mm.
think that's a challenge I can leave out there for the nursing staff. How are we going to solve that
Yes.
problem?
Definitely. And I think it's actually very inspirational to think there is possibilities to
Exactly.
still ensure that connection and that touch and very creative ways to do that.
Yes, I
Yes.
think so. Yeah,
Thank you so much for sharing your journey so far. And I think really I learned a lot from you in this discussion and also realized again how important presence is.
absolutely, absolutely. And thanks for bringing that part to the forefront and making sure that nurses are not only competent, skilled nurses, but that
Mm,
we really have that level of caring and
mm,
presence, because I think that's the more important part. Skills can be learned, but
mm,
being there is something that it's much more difficult to learn, and you need to have
mm.
it. That's where that the calling of nursing come in, I think.
Definitely. Yes,
Yes.
definitely. I agree with you. And positive role models, as
Yes.
you experienced.
Yeah.
I'm sure that the team encourages one another as well when they
Yeah.
see one another's example.
Very true.
Yeah,
Very true.
yeah. Okay. Thank you so much. Do you have any webpage or anything that you would like to promote?
Emerentia for breast cancer, yes. There's a very nice breastcancer.org. It's a USA website, but it's very frequently updated and it have a lot of healthcare professionals that actually also work on the page. So it's good information that one can actually use. And then there's a Facebook support page. Um, Cancer Babes South Africa, if I remember correctly. And they are very, very good with internet support of each other. And it's a group where women can really, or any woman with cancer, not only breast cancer, but where they can ask and say, well, today I feel like I can't get out of bed. And then there's a lot of support who would say, well, that's okay. You can feel like that. And tomorrow you may feel better. And then tomorrow that same person will share and say, well, she actually did get out of bed and she went for a walk or a jog and now she feels like this. So I think those would be two very important on the breast cancer spectrum. I think those would be very important resources that every woman needs. And then, of
Thank
course,
you.
check for breast cancer and check for cancer. Go for your screenings because if it's caught early, then the treatment is very effective, although very traumatic, but very effective. And then at least you can now you can do something about it. Don't leave it and think it's just going to go away because it doesn't. And if it returns, it may be the end of your journey on earth, and then you prepare for a lot of those things. But on the other hand, it may also be that it can still be a curable recurrence that you need to go through, and then after that, it's done. So there's so many scenarios. The point just being, you need to live where you are grown, where you are planted. There's this nice saying, I need to grow where I've been planted. And I need to blossom there. And I think that's important. Doesn't matter what your situation is, we each have a package, but what do you do with it and how do you plow back into other people's lives? Because you can, irrespective of what your situation is. Thank you.
Thank you so much for your positive words and encouragement. I'm sure that it will inspire many people. Thank you.
It's a pleasure. And thanks again for having me.
It's a pleasure.